Everybody, my name is Dr. Justin Dickover. I am a chiropractor at Palmercare Chiropractic in Falls Church. Today I just want to talk about how chiropractic can help people with a variety of headaches. So I was taught in school that there's like 27 different types of headaches, and they all have various causes and things that can affect them, and all sorts of different things that can happen from them, right? The two that I want to highlight over today is what's called a cervicogenic headache, and then the classic migraine presentation. All right, so if you want to look over here, so this is some of the anatomy that is in the cervical spine, right? So behind the base of your skull, there's a ton of muscles called your suboccipital muscles that actually directly connect to the bones in the cervical spine, right? So if there's any distortion one way or the other, if there's any rotation, any tilting, anything like that, you can imagine that a lot of these muscles are going to be upset and angry, and they're going to be firing in different ways, right? So that can cause a lot of the pain that we can feel right here in the base of our neck and travel all the way up. Recent research actually suggests that the lower down the cervical segment that there's misalignment, the lower down the symptoms of pain is, right? So we can also assume that as you go higher up, the more pain is going to be present in the top of the head, right? So if C1 and C2, the first two bones in the neck here, if those are misaligned, a lot of times we're gonna feel pain at the base of our skull that travels up to the top of the head and actually can come around to the top of the face as well. So it's really, really beneficial to come to a chiropractor to get adjusted to help calm those muscles down so you can relieve a lot of those headaches. And the classic migraine presentation is one that you'll notice typically on one side of the head. There's typically a change in your vision. It's affected in some way, shape, or form. Loud sounds make things really bad. Loud, bright lights make things really bad, right? And most of those come, again, from the exact same area in the lower portion of the, in the lower portion of the upper cervical spine, which is kind of confusing, but basically it means the C1, C2, and the base of the skull. When any of those are misaligned, it can cause a lot of the shooting pains into the top of the head and to the front of the eye, which is, again, what we see in that classic migraine presentation.